What are the ethical considerations in veterinary emergency care? When we think about veterinary emergency care, we often picture urgent situations where pets need immediate help. But have you ever wondered about the ethical considerations that guide veterinarians in these critical moments? Let's break down what veterinarians must consider to ensure the best care for our furry friends. First, veterinarians have a duty to provide care. If a pet is in extreme pain or facing a life-threatening condition, the veterinarian is ethically obligated to act. This means they should provide treatment to relieving suffering or stabilize the animal until further help is available. If the pet owner is not present, the veterinarian can still proceed with care until consent is obtained or euthanasia is deemed necessary to prevent further suffering. Next, veterinarians must recognize their limits. They need to be aware of their skills and the resources available to them. If they cannot effectively manage an emergency, they should inform the pet owner and refer them to a more qualified provider. This is essential to ensure the animal receives the best possible care. Continuity of care is another important aspect. After emergency treatment, veterinarians should send medical records and patient information back to the primary veterinarian or another provider chosen by the pet owner. This helps maintain ongoing care and prevents any gaps in treatment. Communication is key in emergency situations. Veterinarians must clearly explain treatment options, expected outcomes, and financial responsibilities to pet owners. If a pet owner declines further care or cannot afford it, the veterinarian may ethically end the veterinarian-client-patient relationship after ensuring the animal's immediate needs are met. Accessibility of emergency services is also a vital consideration. If a veterinarian is unavailable, they should provide pet owners with information on how to access emergency care locally. This ensures that pets receive timely treatment even outside regular practice hours. Veterinarians must also balance their professional responsibilities with their personal safety. They are not ethically required to provide emergency care if doing so would put their own safety at risk. It is important for them to consider their well-being and the sustainability of their practice. Finally, end-of-life considerations come into play. In cases where a pet is suffering and cannot be helped, euthanasia may be an appropriate option. Veterinarians should approach these decisions with compassion, respecting both the animal's welfare and the wishes of the pet owner. In practice, veterinary clinics should have emergency protocols in place to ensure a rapid response. Ongoing training and resources are necessary to handle common emergencies or stabilize patients before they are referred. Clear policies on communication and consent during emergencies help manage expectations and ethical obligations. Collaboration between emergency and primary care veterinarians supports seamless patient care. Ethical considerations in veterinary emergency care focus on the veterinarian's responsibility to relieving suffering, provide competent care, and maintain clear communication with pet owners. These responsibilities are balanced with respect for the veterinarian's limits and the need for professional integrity.